Hi, I'm Dr. Susan Rich. I'm a child psychiatrist practicing mainly with children with neurodevelopmental disorders and anxiety disorders. But the reason that I am launching this channel is to raise awareness about a problem known as neurodevelopmental disorder associated with prenatal alcohol exposure, and to let people know that this is a treatable condition. Really, every day of the week, child psychiatrists see children who have this condition, and it's not just a condition that stops when the child reaches age 18. The condition actually continues through the life course to one degree or another. Largely, it is known in the lay press as fetal alcohol spectrum disorder, but we in the United States now appreciate the diagnosis of neurodevelopmental disorder associated with prenatal alcohol exposure. It's really the topic of a book that I wrote, which is The Silent Epidemic, A Child Psychiatrist's Journey Beyond Death Row. I wrote the book over about a 4-year period after the incident at Sandy Hook really caused me to see that the work that I'd been doing for many years, linking neurodevelopmental disorders and problems with juvenile delinquency, probably was at play in the boy's case, Adam Lanza, the young man who perpetrated the mass shootings at Sandy Hook. I started on this journey many years ago, back in 1992, after reading a book called The Broken Cord, and that book led me to leave a job in pharmaceutical research and go back to school to do a Master of Public Health, and then eventually to do a Doctorate of Medicine and psychiatry training, then child psychiatry training. So over the last probably 13 years, I've been a practicing child psychiatrist here in Potomac, Maryland. I wrote the book while being a psychiatrist, but at the same time, because of my Master of Public Health background, I really have the interest in not just treating the condition, but helping understand that it happens very early in pregnancy, and that what we probably should be doing more of is helping young women who are sexually active understand that they need to use reliable contraception if they are using alcohol. So with that, I decided to launch this channel so that I could begin reading excerpts from my book, and then also use it as a part of a either podcast or webinar that individuals can interact to some degree with me and to learn more about how I'm treating this condition. And in no means is this channel meant to substitute for seeing a psychiatrist or a developmental pediatrician for you or your child. It would be very helpful. It is often helpful for parents to get guidance from professionals, not just for their child, but really for themselves and for their own understanding of their trauma from childhood and how that may be impacting their parenting of their child. Parenting styles in working with these kids really do matter, because positive parenting can go a long way to help these kids develop into productive members of society by developing life skills early on, adaptive functions such as social skills, practical skills like hygiene and self-care, and how to manage an apartment, or how to take care of their laundry, doing things like that, as well as applying their academics to daily life. So telling time and managing a checkbook, and things that usually seem very easy for individuals who may not have neurodevelopmental problems. For these young people, it is a big problem. And since many of these young people are adopted or in foster care situations, it's equally important for the parents to have support of their own so that they can deal with the loss and the grief of having a child who has these conditions. For birth parents, there are a number of programs available for not just substance use treatment, but also for support in raising children who have fetal alcohol spectrum disorder. There's one group called Circle of Hope, run by the National Organization on Fetal Alcohol Syndrome, and that's a really important group to be a part of if you're a birth parent of one of these children. For foster parents and adoptive parents, there are local support groups springing up all over the country. Many of them are really promoted by the local branch of the National Organization on Fetal Alcohol Syndrome. Every state pretty much has their own branch. And you can find out more about that at nofast.org. But in the meantime, I'm going to begin reading excerpts from my book. And like I said, I would love to have feedback from people because this condition isn't going to go away unless, we all put our heads together and start to solve this problem. And really at the local level, at the level of, your county and your state, the national government has put a lot of effort through the Centers for Disease Control and through the National Institutes on Alcohol Abuse and Alcoholism to help put out information and to do research to discover new ways to not just treat the condition but also to prevent it. Unfortunately, there's not enough research dollars, and much of the research that's being done more, I guess, at the grassroots level is on helping the individuals once they are transitioning into young adulthood. So every year there's actually a conference in Canada that brings together researchers from academia to the government to local people, parents, lay people, grassroots efforts. And that would be something to connect with also. It's in Vancouver every year. And if you just Google the Vancouver FASD conference, annually there is a conference, but every other year it's for transitional age youth and adults. And on the alternative years, it's for children, mostly children and younger ones. So with that, I'm going to pause, and hopefully you can find something interesting out of the chapters that I will be reading. I'll start with the more narrative chapters, and I probably won't get into the ones that are more heavy duty into the science or the research. But we can talk about some of those things when we begin doing the more chat sessions. So I hope you get something out of it, and looking forward to your responses.